Hi, I'm Dr. Mollie Marti, and welcome to Resiliency Matters. Today we are speaking with Thembile Gola, who is a student in clinical psychology, and she runs the mental health and resilience programs for our partner in Zimbabwe, Consolidated Africa Services. Thembile is also the recipient of Worldmaker's 2021 Promise Leader Award, and you will soon discover why. Welcome, Thembile.
Thank you, Mollie.
Let's start with a bit of an introduction to Zimbabwe, perhaps through the eyes of your upbringing.
Okay, so I don't like to disclose my age, but I'm 24, just 24 in November the 10th actually. And I grew up in the urban areas mostly. You will notice that because our parents are a lot of the baby boomers, so there's not much emotion there. There's not much cuddling and all of those things. So you don't get to have a lot of conversations, even though you feel they're necessary, right? And it grows into a way of life that you then also adopt. But yeah, I'm the last of two girls in my family, and I transitioned between one province to the next, which have different cultures and languages. So I'm Thembile, but I grew up in Mashonaland, and I only went back to Thembile for high school. So by the time I went back to Thembile, I had this disconnect in terms of language where I was learning Shona for like 7 years, and then I had to transition into like Ndebele for high school. So that was a bit difficult for me because it's not just the language in Africa, it's the culture, it's the way of doing things, it's the way you talk, the way you walk, the way your nonverbal cues go on. So it was a bit of a struggle for my first 2 years. I felt like an alien left to my own devices for some time, and finding my feet eventually had me feeling like, okay, I don't think I want the next person to go through this at the end of the day. So, because then it made me feel very timid. And at the same time, I did quite learn a lot because now I'm bilingual, at least on this side of the world. And from there, I kind of sort of, I would randomly get, sometimes it'd be just a stranger, right? And then you happen to be standing next to each other or sitting next to each other, and they start divulging, a conversation about bread turns into a conversation about life. And at that point, I'm like 14, 15 years old, and someone who's 41 is telling me some of the most intimate details of their life. And you only realize when the conversation is over that, hey, that was not the most typical thing to happen. And I didn't realize it was psychology that I was into until I was sitting in the classroom at university level one day to be like, hey, okay, I kind of like this now. So because of the way in our African culture, there's not much room for emotional connection, even within families. It's families that choose to actively do it the other way that will be able to facilitate that. And we grow up in the same way, in the sense that it has to be an intentional effort to make room for your emotional processing, your mental processing at the end of the day. So I think that's what drew me mostly to wanting to hold hands with anyone else that feels a certain level of difficulty at some point in their life, because I don't say I understand, but I can relate to feeling timid, to feeling small, to feeling unheard and not listened to. So yeah, basically, yeah.
It's really interesting. I have like 10 questions in my mind. So one thing that comes up, as you're talking about the African culture, and that so many of our viewers, this is an introduction. And one of the Worldmaker guiding principles, as you know, is think global, act local, right? These are global issues of mental health. They are shared human needs and that we're addressing. And the answers lie in communities and organizations, in nurturing relationships, in building on our unique strengths and honoring and uplifting that unique culture. So talk a little bit more about what that process looks like in your work in Zimbabwe.
Okay. Well, what I've come to realize is that in as much as certain things may sound foreign in quotes, they're not really foreign, but it's about awakening the whatever roots it has deep down under the surface. It's to facilitate the room where people can allow that part we're taught to ignore to come out. So in terms of facilitating reconnections, facilitating building relationships amongst each other and communities, it's something people already understand, but they need somebody to hold the torch for them. They need somebody to build the stage for them, for those things to happen, to know that, okay, I can relate to what you're saying. Okay, if you're saying this A, B, C, D, okay, I understand because it's missing in my life, or this is something I've been experiencing. So it's about having more people that are willing to start the conversation, having more people that are willing to initiate the change that actually everybody wants at the end of the day, but it's just about who's going to start. So I think that's been interesting to see that, you know, even when it comes to accessing psychological services, it'll seem like there's a huge resistance. In fact, there is, because there's so much taboo and cultural resistance, but you'll find that people outside of the public eye will come and access services, will come and ask more questions, will come and, you know, seek more. You know, you can tell that it's something they understand already, but they needed somebody to start the conversation. They needed somebody to be readily available to for them to be able to latch on to whatever it is that you're saying. So I think there's potential for like a dramatic change, right? But more of us need to be willing to build the stage, start the conversation, and, you know, lead the way, basically. That sounds so cliche.
Yeah. No, it's promise leading, right? You're leading this new way for future generations, as well as your peers. I was really struck when I learned it was in the context of a symposium that we've done together. But when I learned that Zimbabwe has 1 clinical psychologist per 1 million people, right? So in a context of, say, 15 million people, 15 clinical psychologists. So you're part of that change as you're moving through your master's and, you know, PhD and becoming a clinical psychologist. But you also are saying there simply are not enough clinicians. That's not the answer. We'll never have enough capacity. And we're finding that in our schools and organizations and communities globally. Talk about that. Like, you know, it highlights the need for some of these community-based solutions.
Yeah, well, that's true. There is enough clinicians, and you're right, there'll never be enough, to be quite honest, which is why I like the idea. Like, an ideal world in my head is a world where everyone has the basic capacity to self-help. You know, everyone has the basic skills to get through a tough patch in their lifetime, and suicide and giving up slowly fizzles out of our vocabulary altogether. Because you'll find that even if we have enough clinicians, not everyone thinks of getting professional help first before everything. Most of the times you find that, especially on our side of the world, when they come and see you as a psychologist, you're like option number 11 after they've tried everything else at the end of the day. So once we decentralize services in a way that people are empowered to take agency over their lives in a way that affects positive change, even in the toughest of times, I think we'll be doing better, because not everyone can invest in the 6 to 8 years of learning that we go through at the end of the day. And seeing us come to the charge and all of that. But however, if we empower communities to make it a part of their culture, to include things that torment us emotionally and mentally, and even things that make us happy emotionally and mentally, it'll do way more good than increasing the number of clinicians and professionals at the end of the day. And because a significant number of our population lives in the countryside, right? And for Africa, the countryside is usually extremely marginalized economically, right? So for them to access a professional service, it means traveling to the capital city at the end of the day. And at the end of the day, it's all not sustainable to a certain part of the population altogether. So at the end of it, we do need to invest more in intervention centered around communities and intervention centered around community leaders and young people within communities in different areas. Yeah.
Excellent. So I've mentioned this Promise Leader Award, and I want to read. It's presented to an influencer under age 30. You've already disclosed your age, and happy belated birthday. Dedicated to creating solutions for today's interconnected and dynamic world, contributing to a narrative of human resilience. It's so well deserved. As part of Worldmaker's commitment to mentoring these Promise leaders, the next generation of leaders, this award also carries a seat on our board of directors, and you've been actively engaged in that work. I'm curious what role mentorship has played in your life and in your achievements thus far.
Okay, well, it's been 50% of the work, to be honest. I mean, the motivation partly comes from seeing others being able to do it at the end of the day, which is another issue we have. I think growing up, I never got to see much, especially females doing different things and achieving a lot of things. So it means a lot to get people, number one, that are willing to take you through the experience, that are willing to tell you what they've gone through, that are willing to tell you yes and no and guide you at the end of the day. So sitting on the board of Worldmaker for me has been quite significant. It's a different kind of exposure to different people from different places. You know, we've got so much to share at the end of the day. So yeah, it's something I will carry with me for a very, very long time.
And I know your mentor at Consolidated Africa Services at home also, you know, is quite the extraordinary mentor and invest in that next generation. So yeah, it's really good to see you so actively engaged in that mentor-mentee, and we learn from you every step of the way as well. So viewers, more on global and local mental health leadership when we return.
Whether it's advice on managing your anxiety or tools to help you stay grounded, Coping-19 provides a range of resources and self-care tips to help you cope with this pandemic. We can help. Find the resources that work best for you at coping-19.org.
Thank you for virtual family dinners and long-distance birthday wishes. Thank you for sweet streaming melodies and spontaneous dance parties. Thank you for keeping classrooms together and learning alive. Thank you to our incredible network of employees who make all these beautiful connections possible.
Today, more than ever, you need fast, reliable internet. At Mediacom, we want you to know you can count on us. Our fiber-powered 100% gigabit technology network was built for the future. We have enormous capacity and power and 99.99% network reliability. So even though these are uncertain times, we're prepared. And you can be certain we'll keep your world connected. Every second, 127 new devices connect to the internet. You can feel it happening. Our digital world expanding with every breath. We're entering a whole new era of connectivity, and Mediacom will be ready to power it with one of the nation's first 10G platforms. We'll be bringing you more speed, more capacity, more security, and the power to do more than you ever dreamed possible.
Hi, I'm Dr. Mollie Marti, and welcome back to Resiliency Matters. We are speaking with Thembile Gola, who runs the mental health and resilience programs with our partner Consolidated Africa Services in Zimbabwe. Thembi, we had a resilience symposium scheduled in 2020. We've been doing this work, pre-COVID, and then COVID bumped to 2021. We're now scheduled for August 1st, 2022. Fingers crossed. In the meantime, we held an international symposium that was broadcast on Zim TV and through Facebook. So, we continue to do the work. And then you guys are doing a lot of work on the ground, and we're, supporting in that way. Really love for you to talk about your community health days, work you're doing, in exploration and partnership with Rotary International, and also it's in support of the United Nations Sustainable Development Goals. So tell us a bit about what's going on in your communities.
Yes, we're very, very excited about the Community Health Day. So basically, it's mass screening in, again, marginalized communities where it's not just screening, but then it brings about, disease awareness and linkage to care, and again, self-help at the end of the day, because you will find that again, a lot of services in our side of the world are quite centralized. So this will bring services to a lot of parts of the country. And already Rotary has been doing it in several countries already, with over 30,000 communities reached so far. So we're excited to bring this to Zimbabwe in a way that is scalable and sustainable, and in a way that will result in interventions and solutions that are relevant per community, per province, and for the nation as a whole. So we're engaging a lot of stakeholders locally who are interested in terms of the different communities that certain corporates exist in, their workforce, and it's looking good on our end, yeah.
Excellent. And some of your work, you're working to heal disconnections as part of how I see your work, and that's disconnections human to human. It's also human to nature, human to environment. And that's something that it looks different from your African culture or Zim culture than ours. And can you talk a bit about that?
Yes, so I think with the advent of the pandemic, COVID forced us into like a new reality where we were forced to stay at home. I mean, we're used to being at home, but usually it's because we choose to. It's not because you don't have a choice, basically. So I think people realized how mental health does not have a target audience or a target demographic. At the end of the day, it's something that affects all of us in one way or the other. And at some point, we all had to rely on our environment to say, okay, what can I do within my space to make sure that I still feel okay at the end of the day? So what we're trying to demonstrate as an organization is how to leverage on the healing power of nature to ease and to aid us through some of the toughest periods in our life, or just to help you through a tough day, or even when you need to de-stress or decompress. Because to be fair, a lot of the pharmacological medicines we use come from nature. At the end of the day, it's one herb or the other. And sometimes spending 5 minutes in your garden, or taking a walk somewhere, or being barefoot, makes a difference at the end of the day. So it's something we're trying to demonstrate as part of our self-help, our advocacy for self-help, to say our connection with nature goes beyond the technical and the physical. There is something about our existence that preserves nature, and there's something about nature that conserves humanity. So in preserving that relationship, there's also a healing effect on us as humans in how we exist at the end of the day. So we're definitely latching onto how COVID showed people how much the environment is important to them at an individual level, for them to be able to practice it more and tell others how to do it. So yeah.
Excellent. Another sector that we have been working with you on is the correctional system. Your nonprofit has an MOU in place with your ministry, so to provide first responder support. And I'm learning a lot about what that starting point is when you go in and you're just working in issues of mental health, in providing what would be considered kind of basic resilience education. Talk about what we're learning and that starting point, and what are some of those conversations that you're finding helpful on the ground.
Yeah. Well, so far it's been an interesting start. It's been an interesting journey with prisons and correctional services on our end. They're very receptive to what we have to offer in terms of building resilience and interventions that will, because they exist in a unique space. Their job is very unique, so it will be oblivious to ignore the fact that there's mental health effects involved in the day-to-day running of their job. So I guess what we need to improve on is, waiting for things to go wrong, or waiting for things to deteriorate before some sort of help or intervention is offered, but to continue to use this as a starting point, to make it a standard, to include things that help the workforce, the prison officers, the prison guards, the prison officials, to do a better work, because they're taking care actively of a certain population around the clock, around the year, at the end of the day. So yeah, we're very excited. I'm very, very excited about it right now. So we're going to start sometime this month with something with management, where we will explain the work, because they're going to be the custodians of whatever it is we're going to be offering moving forward. So getting them to understand and sensitizing them on the need for the work that we're doing will definitely make it easier for us and anyone else coming after us to make a significant change and make things better. But yeah, I'm very, very excited. Yeah.
Excellent. Yeah, we say these things in our work. We say, resilience is strengths-based, or it's proactive. Don't wait for the bad thing to happen, but start the work. We talk about meeting people where they are, and that type of work that you're doing is really bringing that to life. And you do need to recalibrate. And I also think it holds up that anyone can start where they are, and there's help available to do that. So really enjoying learning along with you. Another piece of the correctional work it is on the other end of the spectrum. It's something that I think is so innovative, and that's the First Lady of Zimbabwe opened a female prison. That's an open prison, and that really acknowledges women's role both in their family and in the community. Can you talk a little bit about what that looks like?
Yeah, I think it's a tough realization into action that you cannot take a woman out of the household and make her absent completely. Even though there's, a certain wrong done against the law, there's a need to sustain the role of the woman in the community, in the household at the end of the day, because life is definitely not the same when you do that. So it's an effort that I think is very, like you're saying, innovative, and is very positive. It's very positive in the long run, even to say it's important to realize that it's not very effective, even as a part of the rehabilitation, to have them secluded in one and isolated in one area, but to have them, it's an important part of the rehabilitative process to have them still work in the community, still contribute to their households, and still contribute to the community in a way that still holds the only way that still holds the family together and still holds the community together at the end of the day. So yeah, I think it's been a long time coming, but like it's never too late either. So yeah.
Absolutely. Yeah, and the idea of incorporating not only vocational training, but resilience training, mental health and resilience, capacity building work into that system is, I'm excited about that as well. You guys also, CAS has a MOU in place with another ministry, the Ministry of Health and Child Care. And what are you seeing with your kids? We're queuing up our first pilot at a local middle and high school with you. But what are you seeing through COVID with your youth?
Well, I think a lot of it has come through work as a student clinical psychologist to say there seems to be an acute rise in substance use in Zimbabwe of late, because you see a very high admission rate of substance-induced psychosis at the end of the day. And at the same time, you realize that there's a lot of children with disabilities that are not exactly addressed the right way. And, you know, a child with maybe cerebral palsy or any other disorder is put into circulation with kids that are, in quotes, not disabled. So, and at the same time, it's the staying at home for long periods of time and going to school for an intense couple of weeks, it's brought about an interesting regression to an extent, which has been interesting to see. So I think it's all still at a phase where it's watching and recording and seeing what exactly to do about it. But there is a lot of work to do, not just for us, but for the country and the world in general. There is a lot of work to do. And again, ministry is very receptive and willing to engage with anybody willing to help. But yeah, it's interesting what COVID has brought out throughout this time.
Yeah. And speaking globally and the work to do, you know, I'm just back from London. Corporations and organizations are also really struggling with workplace resilience through the pandemic. Anything you can add on that? And I'm not sure how closely you work in that sector in Zim, but anything you're seeing there?
Yeah, so I think in yours has been a talk of the Great Resignation. I think it's also kind of affected us in this end, where people have kind of really weighed the value proposition in terms of what it is they're getting out of their work outside of financial remuneration and stability and security at the end of the day, to say a lot of people have left their jobs, but also a lot of people have been retrenched from their jobs because companies have realized that they don't need as many people as they had before. And I think for the first time, a lot of corporates are intentionally investing in mental health for their workforce and for their staff to say, okay, this is something that definitely needs attention. So yeah, it's another interesting fact to say people make time for that now more than they did before. People recognize that now more than they did before. Yeah.
Well, and thank you for bringing the conversation back to, you know, this isn't all bad. It isn't all negative. There's opportunities. There's opportunities for growth and coming through stronger and more wise and more united. And so that's the work. As Consolidated Africa Services says, we don't just believe change is coming. It's already here. We are the change, and you invite people in. So Thembi, thank you for helping lead this change as Worldmaker's Promise Leader. Really enjoyed our conversation today. And thank you, viewers, for joining us on Resiliency Matters on MediaCom NC22, your local programming leader.